We are live. Welcome. How you doing?
I'm doing good. You know, you get the best of me on a Friday, so, you know, that's always a good time to spend time with you
Same. We could do
and for
this
you
on a
to spend time
Monday.
with me.
Yeah, talking on a Friday definitely, gives us a little boost of energy. But
hmm
I'm excited about what we're going to talk about today. I think, we're going to maybe initially talk a little bit about kind of advocacy in our roles as psychologists and what that looks like and expectations, internal pressure maybe. So I know that it's been on my radar several times this week in terms of, you know, what advocacy looks like for me and how do I talk about that with clients.
Yes, that is it is I think it's such a good topic because I don't know about you, but advocacy feels like something I might do like on a micro level every single day. And there is, I think, a voice in my head or a sense of self-judgment about when and how that advocacy does or doesn't take a more, if not a macro, capital M macro, but a little bit more global perspective versus just in my sessions.
Yeah. Yeah. For me, I think just, part of my building of my practice was kind of finding my niche and like, area of specialty. And, I primarily work with gay, bisexual men, LGBT clients in general, probably 90% of my caseload. So, part of my therapeutic style and just personal style is to be pretty transparent about my identities. And, my visible identities as a white man are part of what I bring into the room, but
Mm.
I'm also open about, being gay and cisgender. And so I think what I noticed though after a while, or even maybe from the get go with clients, is that they perceive my identities, meaning, connects to certain beliefs I have or certain perspectives of the world or maybe similar reactions or similar processes as them. So it often becomes a dynamic, sometimes that is talked about openly in terms of what do they expect from me or, what are they thinking,
Mhm.
how I'm perceiving what they're talking about. Um, and I think even in the year 2025, there's been a lot of sociopolitical, cultural issues that come up, and I think it's hard to not also be a person in the room,
Mhm.
work in those kind of moments.
So no, that is so good. I think I experience it similarly. It's that sense of over-identification. You talk about it being a dynamic in the space, but it is that is psychodynamic or even psychoanalytic and theoretical conceptualization that folks might over-identify with what they know about you, right? And that's the risk of therapy. Um, Not that it's a bad thing or you're doing anything wrong. It's just how do we really intentionally work with that? And so, interestingly enough, you said that sometimes you bring it up directly in the room, and it makes me wonder about the times when you may not, when you choose not to bring it up in the room.
Great point. Um, well, I think, sometimes like when I've had a recent experience where somebody's really upset with um, current events nationally, internationally, and I think, my role in that is to support them, to help them process their emotions, their experience, really focus on their process.
hmm
And I think when they maybe there's an expectation that I should be just as upset.
hmm
I think in those moments I'm hesitant to not feel like I need to be like, well, no, here's the side that I'm on in a sense, because I don't know if that necessarily does them any help. I think it's more about almost kind of using that transference of what they're putting on to me in that moment, helping them kind of like explore what is it like to talk about this and have me just listen,
hmm
you know. I
Yeah.
think those are the moments that I try to maybe really be cautious not to like rescue them from that discomfort.
hmm hmm Yeah, those interpersonal interventions just being so important.
Yeah.
I think about like what's it like for me to just be listening. And the subcontext would be like, and not meeting you with that emotion or not agreeing with you outwardly or not reinforcing or validating in a way that a lot of times therapy can be focused on, right? And so how do you hold yourself back in that way, especially on something that you do agree with?
Yeah. That's the tough part, you know. I'm
Yeah.
in the moment, I'm like, let me think of examples, and but um, yeah, I think that's the tough part is like maintaining that boundary and keeping the focus on the client, but also not being. I don't believe in like being so distant in that moment that they're leaving the room wondering what I'm thinking or where do I, where I'm
Mhm.
believing about issues. But I try to really stay in the middle, and I believe
Mhm.
that. I believe that the gray is where life happens.
Mhm.
And when I hear somebody talking about cultural issues or experiences in a black and white manner,
Mhm.
and almost in a monologue or in a way of like, this is how you feel too, right, Marshall, Dr. Bewley? That's where I feel a little bit of resistance of wanting to help them get out of that dichotomous thought or belief system. And I think that's the intervention that I would typically go is like, we're talking about this as if there is a right and wrong answer.
Mhm.
And I know this is deeply personal to you.
Mhm.
I don't want to minimize that, but I'm noticing, and even as we're talking, I'm feeling compelled to agree with you out of, concern that if I don't give you a head nod, you're going to be wondering, do I believe what you're saying or do I disagree with you? And I wonder if we can talk about it with a little bit more complexity.
Mhm.
And I think that's the interpersonal side. If I'm feeling like I need to walk on eggshells around a conversation, first checking in, is this my own discomfort? Is this my own anxiety? Or is there something about the dynamic within the room and not wanting to have the client feel like their experience is invalid, but helping them get to a place of how can they do a better job of maybe getting out of that black and white perspective where people can actually engage with them in their lives.
So good. And that's such a good cue, for anybody listening to this to say, when might I need to be really intentional and really take a step back? I mean, as you're talking, I'm thinking about how I can apply that certainly in my own clinical work, but also even in my personal life. I have a really hard time talking about issues that I'm really passionate about with people who don't agree. And I'm realizing that I am equidistant from the middle from them as part of the problem, right? And part of the problem of being able to maintain connection, agree to disagree, be able to share and receive without feeling threatened in that. And so I think that's such a good skill that you're modeling for our listeners, for me, and for your clients. So, not that we need to end it. That's not a summative statement. I just want to provide feedback in the moment about how meaningful that is. I'm just like Rolodexing. The snark in me would be like Rolodexing how often I've failed at that, but I'm just Rolodexing how I might be able to do some things differently around important topics to me so that I might have a different impact. It might, again, going back to what I was saying earlier about beliefs and the way that we think about things impacting our mental well-being, perhaps I might get less upset or feel less personally rejected or uncared for if I were to take a step inward, take a step towards the middle, to be able to recognize that this isn't about convincing. This isn't about needing somebody to agree, although I do want that. It is about being able to share in a safe way without expectation, that's therapeutic, right? And that's humanity.
Yeah.
Yeah.
Yeah. Well, thanks for the feedback too. And I think in those moments I feel clunky with it, but I want to trust the process. And you know, I think it would, for me and anybody listening, it would not be a one-time conversation. It would be something that if I'm going to lean in that way, then next session I'm going to check in. Any
Yeah.
reflections from last session? I know we had some, very vulnerable conversations, and want to create space for this to be an ongoing area for you to express your concern. And, I just want to commit to continuing that conversation with the client.
Absolutely. I'm thinking now about ways that I feel more comfortable doing that around specific topics versus maybe these hotter button issues. And maybe this is kind of going to help me bridge that gap for myself. I find it, I feel much more competent providing somebody feedback about their interpersonal behavior or their just relationally, or about the way that they may be perceived, right? If people are presenting really intensely, how other people who know them less in the way that we get to know them in the therapy room might feel more put off by that because it feels intimidating or aggressive. And I feel it's like the weird part is that I feel so comfortable providing that feedback. And I found that it has landed really well. But I think when it comes to these hot button issues that I haven't mastered myself in staying grounded in, or letting it be okay that maybe they're projecting something onto me about that, those are harder conversations. And so thinking about the ways that my identities might what I get a little differently from you, especially with the transparency around your invisible identities, is that cisgendered white lady over here with a pretty feminine presentation in that probably 8 to 9 realm, right? That people are assuming that I might be more politically conservative than I may be. And so understand stimulus value is what it is, right? So it's not, but my discomfort even in this moment is that I can't control how they perceive me, but perhaps I can control differently or make more therapeutic the experience of just doing what you just did. So I'm my
Yeah.
wheels are
Well,
turning.
and I mean, just that there's some intersections, I think, between our identities, and I think
Hmm.
I wouldn't want to not address that. I do think, as a man and as a psychologist, I think people ascribe more power, maybe inherently or implicitly, to the things I say and
Yeah.
don't question it. And as a woman, I think that you might be challenged differently from
Hmm.
clients. So I think that, I want to acknowledge that sometimes I'm able to confront issues, or set that boundary, or, you know, do those kind of interventions, and they're sometimes maybe absorbed differently based
Yeah.
off even identities we hold, or if somebody's listening and you have marginalized identities or a person of color, like this can go much differently, I
Different.
think.
Yeah. I appreciate you bringing that piece into the space. I think that you're right and true. And, you know, have you ever addressed that? What I mean is I'm thinking about maybe longer term clients who I feel like the therapeutic power or is feeling watered down. And, I do think that those are good cues for, it may be time for a therapy break or a transfer to care with someone new. So that point aside, I know that that's there. I'm just thinking about ways that that has come up pretty recently about being able to say, I think the therapeutic power here between us has been diminished. And I don't know what that may be about. What do you feel that? What do you think that might be about? And having to confront this thing that I'm saying about wellness and well-being is your choice to engage, but it's not an opinion. It's a fact based in scientific evidence and research. And when you say, I don't know if I agree with that, this isn't about agreement. This is about you being able to hear that that's my role, is to give you things that are science-based. So what do you make of that dismissal of what I just said?
Yeah.
So I don't know if you've experienced any of that, and that may be exactly what you're talking about, is that I might have to prove, no, 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 this isn't great Aunt Mabel's advice. This is like the field of psychology is behind me on this one. right? So I don't know.
Yeah. Yeah, that's good. I have like a few things that come to mind. I think, I don't know how much they fit, but I think where I bump up against that is more around kind of behavioral activation, behavioral interventions, working with depression specifically,
Mm-hmm.
and the intersection there when somebody has limited ability status, or there's chronic health issues that impact how much, for instance, exercise they can engage in. I think that's where I feel that struggle. And,
Mm-hmm.
I typically talk about it as, this is not about you need to exercise to lose weight or to, be a certain body image. It's not about that at all. It's about, depression is this shutdown syndrome that's going to keep you in a hibernation mode, and we've got to activate your body. So
Mm-hmm.
that doesn't mean that, I want to respect um, the ability experiences that you have. And, you know, I wonder though, how can we find a way where this can be part of your treatment in a way that works for you?
Mm-hmm.
So let's think
Mm-hmm.
about moving your body versus walking or running or lifting
Yeah.
weights.
Yeah.
And if there's still resistance to that, I think that's where I kind of go, where you're talking about, well, like, I want to be upfront. This is based in research
Mm-hmm.
and evidence. This is
Yeah.
not an opinion that this is how you should live your life.
Mm-hmm. Mm-hmm. This isn't a judgment of you not doing it. Absolutely. No, 100%. I think that is an important point of therapeutic power to be addressed in the room, right? I mean, power and control to be as reduced as possible, and it's inherently in the space, and those things can't be denied. But at some point, we do have to confront when that power is dismissed, because then it's like, but then what are we doing?
Yeah, you're a guru in neuroscience, and I wonder, how do you incorporate that in these kind of conversations?
This is my bread and butter. So if they're in person, I pull out a brain that I have in my office and talk them through and give them a lesson on neuroplasticity and neural pathways um and that concept. The thing that I say gives us hope in change, and why I do the work. And I always make that reference. If not, I'll talk them through either way on a virtual session. But I do very much go into, this isn't just like there's a correlation between, exercise or sitting in sunlight in the morning is good for balancing or regulating your circadian rhythm, or, boosting dopamine release and energy release in the morning, or, all the things that we know. I say what happens is that our brains get stuck in these ruts, these pathways of operating, even if it isn't working for us. That neural pathways aren't based on what's positive or negative or fun or not fun. It's based on repetition and what is automated of sorts in our brains. And so, in the same way that you may have a window open on your computer every time you log in, and that one time it's really frustrating for you because it opens when you don't need it, right? Like our brains do the same thing, and it is very frustrating when that window opens that window of I don't care, of apathy, of anhedonia, right? Of like, oh man, I don't get enjoyment from X, Y, and Z anymore.
Yeah,
When that window opens automatically, it can be very discouraging. But neural pathways and cognitive neuroscience tells us that we can change that, right?
yeah,
And so anyway, I can go into the weeds of it here, but I won't. But I usually really talk about the neuroplasticity, about what we understand about how the brain can change across our lives, and how that really is the foundation of belief that therapists have in whatever language they choose to talk about it in, for how change can happen.
yeah.
So,
I'm sure that helps a lot with also the person, almost like a sense of universality, that this
hmm
is not a flaw of them. This is something that, happens to people, happens naturally in a way.
hmm Absolutely. Absolutely. And that's the way that I choose to talk about it. I think that there are, lots of different ways that folks can talk about it. You know, so
Yeah,
yeah, thanks for asking. I enjoy that. I think it is something that I find my clients really connect to, and I always say something like, well, due to inflation, it's no longer a nickel, it's a dime. But if I had a dime for every time I said neural pathway, or for every time a client rolled their eyes when I said it, I could be retired by now. But they get it, right? It goes back to, I even had, a really cool story just in the past few weeks. A longer term client who has been doing great kind of popped back up on my schedule, and they had some life events that steered them back to old pathways, right? And they kind of found themselves in the muck of that and kind of forgot how to get out of it. And then after a couple sessions, we used our common language. We kind of took the exit ramp, or kind of a new trail path away from that old pathway back to the newer ones that are pretty well maintained and established, but they just got lost. And, thinking about it in a trail system, or so many the metaphors abound for how we can talk about that. But I love that, right? That to me is in alignment with my values as a cognitive psychologist, in terms of teaching people the skills, not just giving them that, feeding them that stuff in the moment, right? And so they've been able to maintain for themselves. They got stuck, they came back in, and they're like, yes, I forgot. And I'm like, that's okay. Even though you've been using this for a bit, sometimes we get lost, and we just have to have a little bit, we need to ask someone how to get back on the trail. And that's what you just did. So, to use a hiking metaphor.
Yeah. It made me think of eagles and how they help their babies leave the nest. I don't know if you know that.
I don't. Say more about eagles.
Well, so my understanding, and if there's somebody out there that knows better, please let us know, but is that, when babies are ready to leave the nest, the eagle mom pushes them out and lets them fall, but then sweeps under them and kind of lifts them back up a little bit and lets them fall and then lifts them back up. And it kind of just, there's this support, but also letting them, not fall on their ass basically, but have some
Right.
support.
Right.
And, almost, I don't know why, not that you're the eagle mom, but it's like, you're letting your clients work on their own pathway. And then if things bring them back, then you help support them and then continue their own journey,
Mm-hmm. Speaking of, you had mentioned just having some experiences recently of folks leaving the nest and maybe not needing to be swooped under, or something of the sort. I wonder if this is a good transition point to talking about that.
Yeah. Yeah, I think, it's interesting because before I was into private practice, there was more of a formal, like, well, I'm going to see you this many times. So there was a little bit more of an explicit, and this last one, this, 10 session will be our last appointment where we
Mm-hmm.
say goodbye and talk about what you've learned and
Mm-hmm.
et cetera. And I've noticed more in private practice, especially people who are maybe private pay, they're not using insurance, and we're both primarily insurance providers, but sometimes a person, I feel like I know when we're getting near the finish line, but that might be next month or 3 months out, or, every now and then it turns out to be today. And I had those kind of experiences where one of the things that I typically try to do is like, how are we doing? And I'm asking about this because eventually, remember, this is the only relationship designed to end. And just kind of helping them, reinforce that one day we will not be seeing each other. And
Mm-hmm.
not because I don't care about you, but because you're going to have the skills and awareness to do this on your own. And so when clients put out there like, I didn't have much to talk about, and I actually noticed the last few sessions I haven't had much to talk about, and we made the conversation go and it was helpful, but I almost canceled today.
Mm-hmm.
I really reinforce and appreciate that transparency, and sometimes that can be avoidance when people don't know what to talk about, but I also think it can be a sign that they've gotten to their finish line.
Mm-hmm.
So in those situations, like this week, what I typically do is offer like, well, I hear that it sounds like you're ready to end. You know, I want to check that out with you, but if so, then we can talk about, or we can shift into this being our termination session, or we can schedule an appointment a little bit out, and, you know, that can be focused on saying goodbye. But I want to give you the, you know, decision there and what you might want or need for yourself. And it varies, but sometimes, like in this week, the person's like, I'm good to this to be our end.
Mm-hmm.
And I'm like, okay, great. And then it, you know, sometimes it can be the goodbye can feel a little quicker than I want, because that's kind of, you know, not how grad school was or how we were trained always.
Right. Well, and the note I was writing was like, it may feel abrupt because I wasn't ready, right? And obviously me not being ready doesn't matter, but it's still an element in the space of somebody coming in with, okay, this is my last one. You know, I want to speak to the personal side or the countertransference aspect of it for just a second, that, you know, I think the two of us relate a little bit more on the way that we believe that kind of regularly scheduled appointments are best for both therapists to be prepared, but also client to come in knowing, versus, you know, a different schedule where it kind of maybe everyone's week is just different. That doesn't work for me. And so I don't want to underestimate that we can become accustomed to having a client and kind of knowing what, you know, and this speaks to no specific client, and should anybody be listening, but like, you know, what a Wednesday at 9 a.m. or I know exactly what my, you know, Tuesdays at 4 p.m. are going to be. And exactly is an exaggeration, but like I'm prepared for what's likely to be involved in that session. And so I do, you know, I think there's no responsibility on clients in this, but I just want to normalize the therapist experience of what that means whenever there's an abrupt change, right? That there is some degree of loss and change for us too, and that our job is so much, you know, we put so much energy into connection that it's a loss of connection in some meaningful way that has been maintained for however long. So I always think that that can sometimes be dismissed of people, of like, that moment in the session when they're like, yeah, so maybe today's our last one. I'm like, ugh, right? Like,
Yeah.
okay, I'm not going to talk you out of that. I'm not going to keep you on my books for me, but it's okay from the therapist side to have that reaction. And depending on the client, it may be something we share, right? Like I'll tell somebody, this is what I say often is, this is the stuff that therapist dreams are made of. And I am so excited that you are ready for that.
Yeah.
And I want to normalize that, you know, how are you feeling about it? Kind of talk about it as much as, you know, whatever time allows, and then be able to acknowledge, yeah, you know, it would be inauthentic of me not to say that there will be a loss for me. Watching your process, being a part of your progress, knowing what the next chapter holds is not my entitlement, but it's a change that I might that's coming with this end. And I just appreciate you letting me be a part of it to this point, right? Really working on not adding pressure, but I think that there's the interpersonal part of it there that may just honor the connection and the intimacy that has been part of the space to that point.
Yeah. That's great. Well, and I think, you know, you being consistent in that way, you know, I mean, I think you're allowing the client to decide how do they want to engage with this goodbye process
Mm-hmm.
in a way
Yeah.
that works for them. You
Yeah.
know, but the truth is, like, we don't often get to know what happens next, and
Mm-hmm.
you know, we might wonder and hope, like, I hope that they've moved on well, or I hope they got that job, or you know,
Mm-hmm.
and that's the part of the process that's a struggle too, is like, you know, we are in this grief process as well with people that we, you know, grow to care about and see regularly, and then
Mm-hmm.
it kind of stops. But I think that's where I go back to, like, and we knew this coming into this space, you
Yep.
know. And next Thursday, I'll, you know, at 1 o'clock, I'll be thinking about you, and I hope that you know, are taking care of yourself.
Mm-hmm. Yep. Yeah. It is. It's so, before COVID and the proliferation of telehealth services, I think termination was differently easy whenever it was abrupt or sudden. Not abrupt and sudden isn't usually fair because, like you said, this was always part of the plan, and we've known it, right, when things are getting better. But when it wasn't planned in that really nice graduate school kind of way. But because of the way that I liked to do terminations and was trained to do terminations, it was easier to adapt in person because my tools for doing that are here. And in a virtual session, I find it a little bit more difficult to do my preferred strategy of termination, with whether it's, some resource cards or a box of things that help represent their progress or and where they're going, or just that tangible aspect of termination for me. And so I guess I wonder about you, how how do you manage virtual terminations?
Yeah, that's a great.
Differently or the same?
Similarly, I think I prefer in person because I have similar, processes that I like to help people with. But I think, if I'm on a virtual goodbye, I still want to talk about, like, do you remember what you wrote when you came in? Like, what was the reason that you sought therapy? Just to kind of see if they remember where they were in that headspace, and then just really help them. Well, and I'll reference, well, this is actually your words.
That is such a good idea.
Yeah.
Yeah.
Well, I think that they like it of like, wow, like I've been dealing with that for a long time, or well, we stopped talking about that pretty quickly. Um, but helping them, like, do you remember where you were at and what you felt like at that point, and just kind of helping them get back into that place where they started.
Mm-hmm.
And I'll have probably given them feedback already, but I'll reference, like, if they say, yeah, I just didn't know how to talk about intimacy, being able to give them feedback and look how far you came. I remember these moments in our work where you leaned in this relationship in your life and how fruitful that was for you. And, so just trying to kind of implement that feedback. And then similarly, maybe to the interventions that we do in person, asking them, like, where do you feel like you are now?
Mm-hmm.
And then talk about that and kind of the work progress they've made. Where do you hope to be? And I do like to talk about, my hope for you is this, and my concern is this. And I think it's like a way that I can help them at least keep some self accountability or self awareness on maybe areas that they need to, continue to work on with themselves, or just not, you know, put out of sight, out of mind.
Mm-hmm.
I'll also ask for feedback. What did
Mm-hmm.
what did you like about our work? Is there anything that I could have done differently? And I'm sharing a lot, so I'll stop there. But I do want to hear how you do the virtual goodbyes too.
I mean, very similar, to be honest. Outside of like reading back what they may have wrote in their intake paperwork, I love that little tidbit. Um, but very, very similar of, you know, and I'll use a lot of metaphor, like thinking about the road trip, that because I usually use a road trip analogy very early in like session one or so, of like, we're all going on an emotional healing road trip together. You're driving the car, but I might be the GPS on how to do that. But you have a lot of autonomy and control in this process. And if you drive us off a cliff, you know, Mario Kart kind of gets we'll start over kind of right before that to see if we can get past that curve differently next time, right? So that'll be how we talk about it. And so I'll say, what kinds of landmarks have been on this trip that we've been on together, or what have been the big features that we've seen, right? Like world's biggest ball of twine, or the ability to, have effective, you know, communication in relationships, or ability to set healthy boundaries for oneself, and whatever it is. So that'll be the way that I talk about it. Definitely asking for feedback. And then, one thing that I took from, a supervisor a long time ago was acknowledging just the end. Okay, this is what we've been planning for. This is what you've worked for. And here's what happens next logistically. And so, the way that is in my practice, I'll talk them through that, and I'll say, assuming this is true, you're welcome to re-engage therapy at any time. Sometimes we need some tune-up. Our car, once you take over the GPS, you need some tune-up, or maybe it needs to be recalibrated. That's okay. Let me know. Well, a session or two here and there, or maybe it's opening a new episode of care for something else that just life happens. Let's remember that doesn't mean it's going to be the same of where it's been here. This is the end of this dynamic as we've known it so far. And in the future, it will be a new dynamic. But it may not, it'll be a new dynamic for whatever reason. It may not necessarily feel that much different. My hope is that everywhere I go, there I am, right?
Yeah.
So I'll acknowledge that piece. And so that's how I do it. And I don't know, maybe that's my own, like, kind of singeing off loose ends or something, but is going logistical. And I think that's important, so that they know that they can re-engage, that it doesn't have to be by forever if they do want to tune up, or if they kind of have an engine failure in the future, or whatever, that they can come back, and that this isn't about perfection. This is about being able to maintain what they've created until, for whatever reason, they can't. And when we all need that, and I normalize that a lot.
I love the traveling metaphor, and there's so much you could use in that.
Well, and it's really true. Therapy is going to be most effective for anybody, especially couples, when it's a tune-up and not an engine rebuild, right? I mean,
Yeah.
Stakes are a lot higher whenever we don't maintain our systems, I think.
Yeah.
But what it makes me come back to also is that eagle metaphor that you had just a minute ago, just a bit. Because I go to termination when they're like, okay, bye, I'm ready, see ya. There's that, maybe even planned. We get the opportunity of like, okay, next time will be our last. Again, that's like best case scenario, especially in the private practice land. But I think about it differently too when folks are ready, but they're not ready, right? It's like that gap between they know that they've got it, and then but the heart doesn't maybe feel confident yet, right? And so I think about that part and what our ethical obligation is to consistently discuss termination and not keep people in therapy longer than they need to be, right? And so I can't think, I mean, so many times I've said, you're doing really good. Wow, what a cool success story. Thank you for sharing, and we go through the whole thing, and I say, well, I wonder what that means. No, I don't want to reduce frequency. Oh, or maybe not quite that. I've gotten it that aggressively before, but I've also gotten it of like, I know, but I don't know that I'm ready to be out on my own. And so I think about what you described with the eagle, and so I often will say, okay, maybe you don't know yet, and how can we expand or extend our time between sessions so that you can gain that confidence and not see that progress as related to therapy, but related to you. So I know that you don't want to decrease treatment frequency, but it's therapeutically indicated that we try that, right?
Yeah.
And so some people are more receptive to that, but I think there can be something very empowering, right? About having that conversation. And, if you're not able to maintain, we can talk about that too, because that may be a different clinical problem, right? Of dependence or attachment, or something of the sort. So, yeah.
It's a callback earlier to your reference on the therapeutic power being reduced, and it's like, I think that's a great place for the therapist to lean in and to know no, we do need to reduce session frequency, or we do need to do this. And,
Mm-hmm.
I think as an insurance provider, or, taking managed care, I think that's in my awareness of like
Mm-hmm.
there needs to be a medical need here.
Yeah.
And being able to reference like you've come a long way, you've taken a lot better care of yourself, and let's celebrate that and work on you trusting yourself more in that care. I
Yeah.
think we agreed to not necessarily foster dependency in therapy.
Mm-hmm. Yeah. I'm pretty sure it was you in another conversation in another space, but this question is coming back of when people are really adamant about not reducing frequency, even though all signs point to that, and they are insurance folks, and maybe they've met their deductible, or they are, they've only ever had a copay, um, is to say, if you were paying the full session out of your pocket, how would that change your perspective? And I don't want to like use money as a tool or a weapon, but it can help people reflect on it,
Yeah.
right?
Yeah.
And they may say, I'll pay for it out of pocket right now. And that may be an important time for having that conversation of, okay, we may need to discuss the difference between medical necessity and ongoing supportive, um, or personal development or personal growth oriented therapy that needs to transition to be personal pay versus insurance based because of that reduction in symptom, improvement in functioning, and so forth. And, I again, I think that those are two big ideas lumped together, but sometimes that can be a way to help people understand, no, I need this, I will pay, or I want this to be a part of my weekly or monthly life forever. And I do believe that therapeutic maintenance is a medical necessity, but there are so many nuances where that can shift for somebody with a really chronic and potentially pervasive mental illness for which they need that maintenance, and for other folks who really feel, um, like they like therapy, if that makes any sense.
Yeah. I love that. And, it reminds me that I don't know where I heard it. I wish I did, but money's always in the room.
Always in
And
the room.
to not, or to deny that, or to minimize that is, unhelpful. And I like how you talk about that in a transparent way, because that is a layer of what's in the room
Yeah.
and within the relationship. And that's why this is not a friendship, or this is not another kind of
Right.
relationship. There is power differentials, even
Yeah.
if they are reduced based off your theoretical approach.
Right. And I'll just, to your point of money always being in the room, I think this is the plight of a private practice therapist is, um, money is in the room. And if it's a self-pay client, or regardless of what kind of client it is, if they are terminating, that's an open spot on your calendar. And I think that every therapist is going to go through a mental process of what, how they, what, I'm want to be diplomatic here about when they choose not to bring up termination, how that might be self-serving for their books, right? And, I think it harkens us back to the ethical obligation that we have about checking in with folks about how they perceive their treatment progress, and, about the difference between medical necessity and preference, or, personal growth. And, I think that people can easily ignore that by just not asking. Um,
Yeah.
and it is terrifying to me to think about continuing to see somebody and have the potential risk of them assuming that me seeing them means that I don't believe that they're capable of not meeting,
Yeah.
right? Like that feels very worrisome. And I think that that for me is crossing an ethical line for me. That's why I take that so seriously. And for folks who don't want to reduce treatment frequency, but it's clinically indicated that they will, or it's time. And I have that conversation so transparent of, this now lives in you, and it's your time to go forth and live it, and to believe in you versus believing that it was the therapy space or me or something of the sort. And if I don't do that, that's me not being congruent with my values as an ethical therapist. So anyway, I'm rambling on that, but
I have a little note list of reminders for helpers, and one of the things I have written that fits well is clients make themselves feel better. A therapist may help, but the responsibility and credit for therapy primarily belongs to the client.
mm-hmm.
And I think that that really is highlighted in what you're sharing, and that
Mm-hmm.
you're empowering them to build upon their own efficacy to handle what comes their way.
Yeah. I think this is probably a new podcast episode topic, but if a therapist loses sight that treatment progress is never theirs, that's what can contribute to feeling burdened by people's pathology or that's very clinically stated, but like that's what can burden us or cause a kind of a savior complex where we're not or we're overworking, being overly available, not holding boundaries because of somebody's symptom increase or something. That their progress is theirs to celebrate, to own, to be held accountable. So anyway, again, I think that's another topic, but I love that.
Yeah. I'm feeling like this was a great consultation conversation, and I'm wondering kind of how you're feeling as we've been talking some important issues out.
I love it. I just appreciate a very real experience of being self-reflective of my own practice as we talk about things. And I just hope that our listeners experience maybe something similar when they hear you say something or me say something, and then they think about where they are on it, and then they're like, "Oh, yeah, I could do that better," or "Oh, yay, check, I'm already doing that." So I that is a lived experience in our flow, and I hope that you have the same experience, but I hope that everybody else does too. So,
yeah, it's the
great way to.
Oh, sorry.
Just a great way to spend a Friday morning as usual.
Yeah. And I was just going to throw out, it's the beauty of consultation. Like we knew we wanted to talk about advocacy and kind of unexpected goodbyes or that process, but did not plan more than that. And I'm leaving feeling like, some needs and, I'm feeling validated and reinforced, and just another example why consultation is so important.
So important. Preach.
Well, thanks for that.
Yeah, absolutely. All righty. Well, until next time.
We'll see you next time. Bye.
Bye.